Well, welcome everybody. It's such a pleasure to see so many of you here, so many familiar faces, so many new names. And we look forward to spending the next 1.5 hours thinking together about how can we achieve mutuality in global mental health. My name is Dörte Bemme. I'm a lecturer at the Center for Society and Mental Health here at King's. And Tessa, do you want to quickly introduce yourself?
Sure. Hi, I'm Tessa. I'm a Tessa Roberts, a research fellow at the Centre for Society and Mental Health and also at the Centre for Global Mental Health.
Excellent, great. So we're going to give a short introductory presentation, then we will hear from the members of our mutual learning platform, but we also reserved a lot of space for discussion today because we really want to have an open conversation about what mutuality is, what it means, how we can achieve it in practice, and so on. So let's begin. Tessa, maybe the first slide, please. So when we think of mutuality, maybe we want to remind ourselves why that is a necessary or an important principle worth exploring more theoretically and practically. And as we all know, the field of global mental health has co-evolved with critiques of its knowledge practices. And this kind of critique and reflexivity has really risen to the level of being promoted by actually key gatekeepers in global mental health. For example, the Lancet Psychiatry most recently in 2020 wrote an editorial that was aptly called "The End and the Beginning of Global Mental Health, Heralding a New Era," by pointing out some of the key issues that need to be addressed moving forward. They write that without sufficient forethought, global mental health may become a globalized iteration of psychiatry's potential to reinforce existing power structures and hierarchies. And in order to mitigate these hierarchies, they call for a new model that recognizes that expertise comes from individuals and communities in specific social, cultural, and economic environments, rather than the world being a blank slate, as perhaps the rhetoric of the treatment gap had suggested. So they say it's very important to go beyond simple and implicitly hierarchical classifications of countries by income, and we're all aware of these terminologies of low and middle income countries, low resource settings, and so on and so forth. And instead they call for a new model that looks instead for mutual learning between communities at a more complex level. Next slide, please. But what is mutuality actually? What does mutual learning look like? And there's for sure no singular definition in the academic literature. They're very complicated definitions that can be found, and we just put one of them here. But what we really want to do in the next hour and a half is really take a praxeographic approach and ask ourselves, how can mutuality be achieved in practice? How can it be defined and contributed to by as many people as possible, rather than sort of like defaulting on academic definitions? And this is what the next hour and a half should be about, and the conversations we want to have with you all today. And in order to kick us off, we want to talk a little bit about a sort of a case study of mutual learning and mutuality, which is a project that has taken place over the past 10 months, which is called the Mutual Learning Platform Together to Transform. And Tessa, over to you to tell us a little bit about that project.
Thanks, Dörte. So as Dörte mentioned, Dörte and I, together with a group of colleagues at King's College London and UCL, got a small pot of funding from the King's Together Fund to create a platform for mutual learning, which we called Together to Transform. And this was organized around the idea of social approaches to mental health. The big idea is that many people with different backgrounds share an interest in the social and political context of mental health, but we don't talk to each other enough, and we fail to learn from one another. There's often a big gap between how academics think about mental health and social issues and how these are conceptualized by practitioners working on the ground. And even within research, the more quantitatively oriented people, such as the epidemiologists and the trialists, often aren't talking to the social science people, the sociologists and the anthropologists who are working on the very same topics. We know there can be inequalities in power and status between people from these different groups that mean that some perspectives dominate others. And of course, I'm sure everyone here is aware that there are also some major power imbalances between international collaborators in the global north and south. And there are lots of barriers to mutual knowledge exchange on an equal footing between people from different geographic regions. including some of those Rita's already highlighted right today. So we wanted to bring together people from these three groups, the quant people, the qualitative people, and the practitioners, acknowledging that these are simplifications and many people span multiple roles. And we wanted to include people working with marginalized communities in both the global north and south in a process of mutual dialogue. So the challenge is, of course, how to achieve that in practice. So to start us off, we invited people we already had some existing connections with and who shared our interest in social approaches to mental health. So you can see from this map, we had 39 collaborators working in 24 countries, comprising both academics and mental health practitioners in the global north and south. And when we first got everyone together, we asked everyone a big question to see how our tiny project could contribute to everyone's larger goals and priorities. And that question was, how should global mental health change? And here are some of the responses, a lot of which link to this idea of mutuality. So there was a desire to bridge the gap between academia and applied mental health work by grassroots organizations, and the need for more two-way dialogue. There was a lot of emphasis on understanding the socio-political context of mental health and the need to understand local realities. There was a desire to transform how people in international collaborations relate to one another. There was an interest in reconceptualizing what constitutes evidence and moving from only academic knowledge to incorporating more experiential knowledge. And there was a desire to work together to change the landscape of research. And we'll hear a bit about what the groups did on some of these topics shortly. So as a first step to try to facilitate mutual learning, we began with a collaborative priority setting exercise to select some themes around which to organize our work. And you can see these 4 themes here. Each participant chose which theme they wanted to work on for the duration of the project. So we ended up with 4 groups. And the idea was that each thematic pod would be self-organizing and would define their own goals, outputs, and processes, and that they would meet regularly over 8 months to discuss their theme and work towards their outputs. So in a minute, we'll hear from someone from each of these groups about what they explored and the key learning points from their experiences. But before that, Dörte will just talk a little bit about how we tried to put mutuality into practice in the context of this project.
Great, thank you, Tessa. So what are the principles of mutuality that we sort of designed for in practice as we embarked on this mutual learning process? So what we emphasized from the get-go really was to give a lot of space for trust building. We encouraged all parts to have what's called a brave space agreement and to use creative methods, which we supplied and some facilitation guide to all part members to really make room for trust building before we embark on this process. We really put a lot of emphasis on power sharing and how can we make sure that this process is not being led by, for example, Tessa and myself as researchers situated in London. How can we make sure this is a process that really rests on everyone's shoulders and agency? So we we started off with a model of 3 co-facilitators, but ended up actually having a rotational model of facilitation so that each meeting, each pod meeting was actually led by someone else, except in one pod, they chose a different structure. But it was really important to have this kind of flat structure, flat hierarchies, and to always insist on collaborative decision-making. We also try to resource everyone as much as possible to participate in this process by compensating practitioners for their time and giving the pods an independent budget that they could use as they please. We provided affiliations and access to literature databases to our collaborators. And we tried to rotate the discomfort of scheduling across different time zones because this was a virtual process. And like you saw on the map, we were really spread all across the world and try to be conscious of rotating discomfort of staying up late or getting up early. Next slide, please. So I want to say a few words about how it went and the feedback we received from our participants in hindsight. And what we felt was very important as we were thinking about mutuality afterwards is that we really want to start off with the roadblocks and the frustrating bits about this process, rather than sort of thinking about mutuality as a lofty aspiration that we by any means achieved. It was really important to work through the constraints and what makes it hard to to work in this way. So we really, and the feedback found that people struggled a lot with the timing, the scheduling, and everyone working already at maximum capacity in many of the other projects. So it was really hard to carve out time for this process, and then again, scheduling it across different time zones. What was really noticeable, and that cuts both ways as both a huge advantage, but at times also a disadvantage, was that mutual learning processes are slower and non-linear processes of knowledge production. And at times this was perceived as meandering and a bit leaderless, combined with this sort of flat hierarchy and co-facilitation structure. At times the process was not quite as linear and straightforward as darting towards output, but at the same time that was also perceived as a huge advantage. And then within the small project, we cannot pride ourselves in having expunged all problems of power and exclusion. Of course, these issues were present here as well, and we found it very important to continuously address them throughout. And here are just a couple of examples around, for example, the hegemony of English as the language that was spoken within the pod meetings, but also that there was a constant tension between the flat hierarchies and open leadership, and some people sort of taking the reins within that process. Let's talk quickly also about what went well, what made it worthwhile. We got an enthusiastic feedback on the kinds of connections, the kind of collaborations and learnings across our differences that really was enormously appreciated by many of our collaborators. We found that people really appreciated the slow process and the kind of like unfolding and expanding of time to build trust and better relational quality, to have different practices of listening and really drawing on each other's different kinds of expertise. That takes time. But a lot of people simply really enjoyed the many different outputs that came out of this process. And we don't have time to talk about the outputs here today, but if you want to explore a little bit what the platform produced, you can find that on our website. And I think Milena or Tessa will pop the website into the chat just now. Next slide, please. So very few key learnings, key ingredients from our admittedly imperfect mutual learning process. I think it is enormously important to think about how to create these flat hierarchies and structures, how to power share and what are the obstacles and barriers, and how to institute collaborative decision-making that moves the process forward. We found it important to leave a lot of space for trust building and a slower pace, and that it was enormously important to have an open-ended iterative process that stayed open and responsive to everyone's needs, so that the outcome and the process and the outputs could actually constantly be adapted to what the group wanted. Fair compensation for the time and work of the participants was enormously important. And also to accept that everyone has different needs, and it will always be in multiplicity of priorities and outputs as the norm, rather than trying to integrate and to work towards like a singular outcomes. We really made an effort to constantly reflect on power, on the constraints, imperfections, and barriers to our own process, and to invite critical feedback about the process and anything and everything going on at all times. And as one of our members actually pointed out in hindsight, was that it is a focus on learning and what we can learn from each other, but that the focus should also be on unlearning our biases and power dynamics in this process. So with this, we actually want to hear from our pods themselves and what they took away from the process, how they experienced it, and sort of the key insights they gained from participating in a mutual learning platform.
Thanks very much, Dörte. So before, we're going to briefly hear from someone from each of the pods, and then we're going to open it up for general discussion. But I can see Rita's got her hand up. Did you want to come in and comment on some of that introduction, Rita? Are you able to unmute? Okay, we'll come back to you.
Can you hear me?
Yes.
Sorry about this. Now, I lost you a little bit because of the internet. Now I'm back. I just wanted to say that I heard you discussing neutrality, and I have a problem with this notion of neutrality. We're not neutral. We cannot be neutral unless I misunderstood. We have to be quite active, taking sides, and it's the sides of those who have been living in injustice.
I think we'd very much agree with that. We were talking about mutuality rather than neutrality, if that makes sense. Mutual relations and mutual learning rather than neutral.
Okay, so I misunderstood. Thank you.
No worries. Good to clarify for everyone. Great. So Hannah, would you mind, we're going to hear from Hannah Jennings on behalf of the Scaling Pod with a brief summary of what their group explored and the key lessons. Are you?
Yes. Can you hear me?
Yes.
Okay, thank you. Okay, so I was part of the Scaling Pod. Thank you for adding the names of people who were also part of that. So we met regularly. There were different members of us from various organizations and countries across the globe. Can you go to the next slide, please? So we were really interested in this idea of scaling from quite kind of local small interventions to increasing kind of reach in terms of geographical location or a greater number of people. And scaling up is spoken a lot about and often, and we wanted something that is a bit of an alternative to this kind of one-size-fits-all, more top-down approach to mental health, which is often seen. And we spoke about wanting to build something that's quite practical, to be able to share lessons and maybe have something like a toolkit. And kind of in the spirit of the whole project, we were interested in social approaches to mental health and also more community-based interventions rather than clinical ones. So I think one of the first things that we did, we had this working definition of scaling that the pod came up with, which was when an intervention that is shown to work needs to bring a new leadership to reach a larger area or a larger number of people. And so, as I was saying, we wanted to look at what had been done and draw lessons from that. So we had two main activities. So the first was the scoping review. So we used some of our funds to get a researcher, Leslie Qureshi, who reviewed both peer-reviewed studies and grey literature. So there were over 100 papers in this review covering 42 programs across the globe, looking at challenges, enablers, what works in scaling and what doesn't work. And then the next stage was we had a series of case studies. So we looked at 6 different organizations that had done this kind of scaling in different countries. So in South Africa, Guatemala, Kenya, India, Uganda, and Zambia. And again, we had someone interview representatives from each organization and look at the learnings, look at what models were implemented, what the mental health impact was, what the challenges were, what worked, and draw out some key lessons. So if you could, sorry, next slide, please. Okay, so this is just an example of a case study. So each interview was recorded and transcribed and then written up in some depth, but then also we had kind of a summary as well. So I'm not going to go into this, but as you can see, there are some key messages, some challenges, the kind of recommendations made, and some necessary resources. And then the findings from both the case studies and literature review were shared with the group, and we had a list of kind of what works and what could work better. And these are just some of the learnings. There were many learnings, but these are just some of the conversations and learning that I pulled out that I think, yeah, were just really important. So I'm not going to go into them all, but I'll briefly talk about some of them. So shared values when thinking about scaling up. and introducing new interventions was really important. So having those shared values with partners and communities as well. And then there could be flexibility in what was done, but it was the shared values that were really important. Think about different types of evidence. Documentation was mentioned by a lot of the organizations as being really important, really documenting what was done and what worked and what didn't. Also, co-development, service user involvement at every single stage, thinking about power relations, and also building on kind of existing resources and cultural practices were important. There were lots of sorry, I can't point to this box that says trade-offs between reach, costs, and speed of the intervention were often had to be considered, because to do this kind of scaling well, you want to maintain quality, equity, and sustainability. So often you do need to, you can't do these things fast, and your reach might not be as great as you would like, or it'll just take longer. It being long-term as well was a theme that really came out. And of course there were, lots of challenges as well, which I'm not going to go into now because I think I'm running out of time. Next slide. So what next? So these are some of the conversations that we've had. I believe the scaling event is actually happening now, so it morphed into something a bit bigger where we're going to, all the pods are sharing. At one of our last meetings, we did think that developing a toolkit could be helpful. We spoke about maybe getting some funding and looking for that to build on some of this work, and publishing the scoping review, which has a wealth of knowledge there as well. So thank you.
Thank you so much, Hannah. That's really helpful. Great. So that was a summary of what the scaling group did. We also have Meenal here to talk about what the community mental health systems group did. Meenal, are you able to unmute?
Yeah. Thank you. Thank you for organizing this. So I'm Meenal. I am from India and currently doing my PhD at University of Edinburgh. So as part of the Community Mental Health Systems pod, our group highlighted the efforts were made to understand and compare different trends and assets and needs of mental health systems across different countries, with a special focus on, the rural as well as what's the difference between rural and urban settings in these locations. Next slide. So we have group members from all across, and as a group, we had members from Ghana, South Africa, India, Palestine, and UK. And eventually we formed into smaller groups with Ghana team, South Africa team, India and Palestine researchers and practitioners working from the different locations, kind of put together a case study from their locations and localities, and I'll get into it on how I did it in next slide. So first of all, how we found our focus. It was quite important to kind of, as a group, to kind of, as Dörte was mentioning, like having a trust and a mutual sort of like a relationship between pod members, because some know someone, but not everybody knows everyone. So first few meetings actually went on building that trust, understanding what mental health in different settings are, what has been people's experiences, what are some of the common large problems or issues which we all as practitioners and researchers have experienced or dealt with within different low resource settings of Ghana, India, Palestine, South Africa, and UK and America. But eventually, after multiple meetings, we kind of were like, okay, these are like following some of the key things which are coming up, and we can club it and club some of these issues and kind of do it in so and so manner. So one of the first things, so couple of the things we then decided was to understand the political economy and different contexts people were coming from, how the social, what are these different forms of assets, because we kind of felt that it's important to, instead of talking about the needs and issues, focus on strengths and assets, which can then be used in mental health interventions of these, from different, which can be a useful resource in global mental health. So we then focused on the contribution of social assets to the community mental health. And what are different forms of informal care? What are some of the relationships, which power relationship within these informal care settings? What does it mean? How does it impact mental health in communities, etc.? And in order to do all of this, we opted out a mechanism to conduct, to present case studies from each of these countries. And we all developed these case studies within our smaller groups, where we kind of had resource of interviewing some of the organization members who have worked and researched, or other members who have done program interventions in these locations. So some of the members of some organizations, we were able to do focus group discussions. So we kind of did 2 to 3 focus group discussions each, actually around 4 or 5 group discussions across these countries, and then kind of put together all our findings and then develop some write-up and then present it to the group over the next few more meetings, and kind of discuss how we want to present, what are some of the things emerging from the findings overall. So all sorts of things. So there was a space to kind of, for all these smaller groups of countries to kind of come together as well, like go back and come together and present the finding and kind of discuss what are different things we are finding. And interestingly, we did find many similar issues which are coming up. So the findings were, some findings were similar, some were different. So kind of then thought through how to present these things in a more structured format. So that's how our process went. Next slide, please. So some of the key learnings and challenges while we were doing this series of meetings and focus groups and write-ups, etc., was we kind of learned that how much important it is to kind of also share experiences with each other, because many of our pod members who are practitioners, they were like, oh, that's a good practice. Okay, that's something which happens with me as well. And that's we have seen that in our setting in this context. So kind of like, there was a knowledge exchange which was happening, and we felt like we all are learning from each other, as opposed to kind of producing something, but also learning while we are, producing a more structured product. And we also kept on thinking about, we should challenge how the evidence is then produced, because there are so many voices from the grassroots which are needed in order to kind of build community mental health interventions. So challenging the ways evidence is then produced in academic settings as well, and using some non-academic resources in building up these interventions, and strengthening community mental health systems. We found out that it was a really interesting mix of academics and practitioners and researchers, and somebody working in both. Most of us like working in as both. So bringing those different nuances to how we then see those findings, and how we then write about those findings, or what are the implications of these findings. Case studies were very useful for our pod in order to kind of learn and put together different experiences, because we could explain it in a better format. So we felt the case studies were very useful learning tools for all of us. Some of the challenges which were like, we understood that mutual learning does need a lot of time and resources. Many of the meetings, we will not have every member show up simply because of the time issue, or because they are already doing some other project, and the lack of time. A human being can only do enough in a day. So finding that balance, and then hence it was a bit difficult, but we kind of eventually at the end, we also agreed that having a longer process, like for 8 months or 9 months when we met continuously, so a person doesn't need to be present for all of them, but they can engage via email. There were a lot of engagements via different mechanisms, like, we were just sharing email exchanges with each other quite often. Recordings were useful for a member who have missed a meeting to kind of look at it briefly and come. Notes were very important, and we kind of had those minutes of the meetings, which were there were many meetings which I was not able to attend, and I could just see the minutes even if I don't have time for the recording, to kind of get into a same plane before the next meeting. So it does require a long time and resources, but as the longer and more constant it was better off. We were better with that setting. Time zones were a big difficulty for us as well, and so Dörte already has mentioned all of these. So these were some of the challenges we also faced as a crew. But yeah, learning that it's a marathon and not a small race, it was important to kind of work with that process for us as a group. Yeah, next slide. Okay, so this is the last one. Where are we heading next? So after these many months of like meeting, producing a case study, doing an FGD, different kinds of focus group discussions within groups, we're like, okay, this is a great product we have now here, and we have used so much of our time in doing this. So we got Karen Matthias, she got a small grant from University of Canterbury to write a paper. So now we are writing up country profiles into an academic paper where we are examining assets and challenges in these communities. And we often meet once a month as well. So that process is continuing now, which is quite exciting, which has came up because something like this happened with us. And we're also considering like going together on ASRC grant. So one of the key things which we kept on discussing during our meetings was how to get fundings, how to get fundings to do these kind of more work towards these things. So we continue to discuss that. Yeah, we haven't yet come across anything as of now. We're not doing any grant work, but this is a paperwork which is happening at the moment, but hopefully we will get into it someday. Fingers crossed. Yeah, that's all. Thank you so much. Yeah.
Brilliant. Thank you, Meenal. It's really exciting, as you say, to see how this has kind of catalyzed a group that wouldn't have come together otherwise. It's going on to do other things together. Wonderful. Thank you so much for that summary. We also have Ashraf, who's going to briefly summarize what the Lived Experience, Resilience and Trauma Pod do. If I can hand over to you, Ashraf.
Yes, good afternoon. So I'm going to give a summary. We had a whole range of conversations on the issue of trauma and lived experience, and also resilience, which proved to be a bit of a sticky issue in the context of situations where there's oppression, political oppression, social oppression, etc. And the concern was that one of the things that was raised was the issue of how resilience works in the context of conditions of social adversity. If individuals need to be resilient to withstand these onslaughts by the context, or if it's the social determinants, the contextual issues that need to be addressed. And one of the concerns is that resilience may absolve the social context and place the emphasis on the individual to be resilient. Can I have the next slide? So in terms of how trauma is made sense of, we had a whole range of different questions, not all of which, quite frankly, were resolved. And some of these questions proved to be matters that we thought need to be investigated more thoroughly in the form of research investigations. So, for example, how do communities in low and middle income countries make sense of collective trauma? Is there such a thing as collective trauma, or is trauma an individual phenomenon where the unit of analysis is the individual? Can there be such a thing as community trauma, in which case we need to think about ways in which we can study community trauma and collective trauma, a trauma that goes beyond the individual. And certainly this is a matter that requires some consideration to move away from the idea of the individual being the unit of analysis, which is historically and customarily the case in a discipline such as psychology and psychiatry. Then what are the experiences and meanings and manifestations of this collective trauma, and also trauma that is ongoing in low and middle income countries? What do we know about this that has been written in the literature, where trauma is not a discrete phenomenon, a discrete event, but trauma is a matter that is experienced currently, consistently, and not necessarily with an end in sight to traumatic events actually ceasing. Can I have the next slide, please? So the lived experience, trying to make sense of trauma by eliciting understanding about the lived experience of community groups. And one of the questions that was raised and partly thought about and answered was, how is trauma in low and middle income countries different from, for example, high income countries? And obviously some of the issues that characterize low and middle income countries are things like social inequality, economic stresses, possible violence, conflict, natural disasters. I just got back last week from the Gaza Strip, Palestine, where I was working with the Gaza Community Mental Health Program. And there the place is under siege. People cannot come and go at all. And they face huge threats from military threats from Israel, but also the inability to actually move around and obtain some kind of economic prosperity. These things are completely cut off to that population. Okay, can I have the next slide? Then another matter that was spoken about in our group are the local idioms of distress, the local narratives and the meanings associated with trauma, and how these local idioms are relevant and pertain to geographical contexts or linguistic groups. So things like my soul is not at peace, my heart is hurting, my mind is not right, I'm thinking too much. They don't necessarily map onto diagnostic criteria that you find in the DSM or the ICD, things like intrusive thoughts and avoidant behavior and hyperarousal and startle shock and nightmares, etc. But they are important experiences that people have, which need to be thought about and considered, and considered as the ways in which people make sense of difficult experiences and traumatic experiences. I spoke briefly about the unit of analysis, the question about whether trauma is an individual phenomenon that exists within someone's own personal experience, or is it a community phenomenon? And, you know, if we accept that it's a community phenomenon, then we need to think about ways in which we can study this as a community phenomenon and conceptualize trauma as being applicable to communities and societies. The challenge is, of course, how do you operationalize this? Because with the DSM and ICD systems, the individual is the unit of analysis, and the operational definitions of a traumatic event or symptoms of traumatization are fairly clear. If we go beyond the individual, then developing the conceptual apparatus to be able to understand and appraise trauma as a community social phenomenon needs to be developed a bit more. So this brings us to the question whether trauma is a diagnostic phenomenon? Is it a nosological phenomenon or a metaphor? Is it a discrete diagnostic entity, or is it a metaphor, or is it both in the context of social trauma? And one of the things that we thought about was whether this is a useful distinction. Part of my challenge also is trying to figure out ways in which we can operationalize the terms that we use to go beyond rhetoric and to go beyond metaphorical use of the terms. And so when we think about trauma as a metaphor, how do we actually research this, and how do we engage critically with the concept? And of course, the notion of precarity, people living under conditions of precarity. Historically, from a nosological perspective, things like economic stresses and environmental threats haven't necessarily been thought of in a direct way as traumatic. But we need to increasingly think about things in this way in the context of events like climate change, for example, and the extent to which this may be a potential traumatic stressor.
Thank you very much. Yeah, so I think you really wonderfully illustrated the sort of richness of some of the discussions that are brought about by bringing together people from such a variety of backgrounds to discuss some of these common themes, and lots of food for thought on the topic there. So last but not least, we're going to hear from Milena on behalf of the Capacity Building and Funding Pod to briefly explain what this group did over the last few months, and then we'll open it up for some more general discussion. Are you there, Milena?
Yeah, hi. It's good to see everyone again. I am the research assistant who worked on the project throughout the 8 months that we were working together, but I also more or less joined one of the pods and became involved in the discussions and now in the kind of ongoing work that we're doing with co-writing. So yeah, our pod formed around the idea of capacity building and funding. We were a relatively small pod, but with, as you can see, kind of a wide geographical spread and also a wide range of expertise by experience. So we had academics, but also researchers who, as was said earlier, kind of bridged practical practice in community settings, and also those who were involved in international NGOs. So we had people at every level and every stage of the funding system. And that is, in the end, kind of what brought this group together around the shared desire to look more deeply at our funding streams, our systems of funding as they exist, and how they might be reformed to get funding more effectively to communities, to the grassroots, and to the people who are already making the most impact in their local areas. Yeah, next slide. So the trajectory of our work together was similar to the other pods. We came together around these common themes in the first months, and then naturally the conversation followed with members presenting their own experiences, sharing their expertise. We had a real wealth of expertise and knowledge and experience in leading community-based organizations. So at least 2 of our members are founders of community-based organizations that are currently doing work around mental health and community support. So often their experiences and anecdotes that they shared shaped kind of the tone and the direction of the conversations with people with different kinds of research experience, kind of echoing certain theoretical points or connecting to kind of the core messages that they shared. So that's kind of how mutuality unfolded in this space. And we began thinking about practical outputs and kind of trying to ground some of our discussions in next steps, which sometimes felt a bit artificial, and sometimes I think was done a bit reluctantly because we did have just such a interesting group and rich conversations each week. And that led into the process of deciding on our output, which is a commentary that we've written together based on the ideas that emerged in our discussions. And this was the idea of one of our members, Rita, who suggested that we submit something to the Lancet. So that's the next step. We're just gathering signatures on our author contributions form now. So hopefully in the next week or two, we'll be submitting. But the process from idea formation to discussion, to narrowing, to framing, outlining, and co-writing, we attempted to do all of that kind of in a mutual and open and transparent way. Of course, running into some of those issues in terms of a lot of us being overstretched, a lot of us not necessarily having capacity, according to the theme as well, to take on extra work without also outside of the funding framework of the project. But we've managed to kind of spread the responsibility amongst group members, and Yune, who's not able to be here today, has led on the co-writing. She's an early career researcher and currently working with Edinburgh Mental Health. So she did a lot of that work of framing and structuring for us. And yeah, next slide. So these are just some themes that emerged in the process of discussing our commentary. So in parallel, we were discussing these issues about equitable and sustainable funding approaches, but also trying to do that in equitable and mutualistic way. And I think that happened quite naturally in this group because, as I said, people spoke naturally from their positionalities at different points in the funding stream. And we realized that if we're going to make suggestions and recommendations to funders, those have to draw from these practical experiences and the very real barriers and bottlenecks that people are seeing when they're attempting to gain funding for their community-based organizations, and also at different levels of the funding stream that can be taken up to the international non-governmental organizational level, where there are all kinds of questions about measurement and evaluation of these programs. So we had really interesting kind of back and forth and threads that ran through these conversations. And in the end, we felt strongly that we wanted to create kind of a common voice, a standpoint from which to speak, which we could do through this commentary, which could bring us together as a group in the public sphere. And that this would provide kind of the grounding principles for further guidance that we either individually as researchers and community members or continuing in the collective of our group could go on to provide and publish. Next slide. So these are the key issues that our commentary covers, which emerged in our discussion. And these generally reflect kind of the barriers to access, such as application procedures being inaccessible, being digitally blocked, being English centric, and then things like short funding streams that don't allow for sustainable funding of grassroots efforts and community-based organizations. We also talked about kind of burdensome reporting requirements, and the issues of not integrating measures that are already part of community organizations' work into that process of proving what they've done with funding. And then we also kind of in the process spoke about these systemic issues, so discrepancies in priorities between funders and people receiving funding, power dynamics based on historical precedent, and kind of the legacies of status quo funding, and often the assumption that funding will flow in one direction from the global north to the global south. And these all were themes that emerged from the group and that we tried to weave together into this commentary. Next. yeah, so it's a little promo. We really hope that the editing process continues and that we get good feedback, and that we can share this with you in published form soon. But we know that this isn't just the published piece itself, it's just kind of a starting point for what we hope will come next in the form of tangible guidance and continuing collaboration between members of our group and anyone interested in forming funding approaches. Yes, so if you look on this, on our webpage, you can also get this through the link that I put in the chat. You can see kind of summaries of our group working process. There's a video that summarizes our group working process. We also have some reports on there already and a summary of our commentary. Yeah, that's it.
Wonderful. Thank you so much, Milena. That's great. So hopefully now you've heard from all of the groups. This, I guess, just hopefully illustrates the richness of discussions that came about through bringing together people from such a variety of different backgrounds and trying to provide a space for mutual discussion. Obviously, this was just one small project. This is not the final word, but we hope that it kind of shows that striving towards mutuality is worthwhile despite the many challenges. And so now we'd really like to hear from the audience, from everybody here, from the participants, about how this resonates with you and with your work. Are there any lessons that would be relevant to attempts to move towards greater mutuality within other projects in global mental health, and how can we take some of the lessons learned, both the successes and the challenges, to promote mutuality more broadly? Would anyone like to share any reflections or ask any questions of the presenters today? Or would anybody who was part of this process like to share any of their own thoughts or experiences on what makes mutuality challenging or worthwhile, or what we should do differently in other projects to ensure greater sort of mutuality in exchange of knowledge between different groups? I can see there's quite a few other people on the call who were involved, who perhaps might like to comment on what they take away from it. I don't know, Crick, I was just about to pick on you and you put your hand up. Thank you.
Glad I'd done that before. So thanks so much, and thanks to all the presenters. It's really just wonderful to sit and listen and hear all that was done in this project. I think for me, one of the things that really stood out was the opportunity to really take time and to reflect on the way in which we work, and also to think, to hear views from a number of different people from their different perspectives on issues that we tend to focus on and move on over quite quickly, often because of the pressure of limited time and limited funding. So I think a lot of our work in this field is very much project-based and driven by particular research projects. And those have particular goals and deliverables, and we need to move quickly. So I think for me, what was really helpful about this whole process was actually creating the space and the time, despite us all being very busy, to reflect on what we're doing in the field of global mental health. And that actually allowed us both to think abstractly, but also to be quite practical. So I was involved in the scaling up pod. And I think the idea of developing a toolkit and some of the ingredients that we put in there, I hope, and I think are quite useful for those of us working in the field. So, it didn't mean that we sort of drifted into entirely blue skies, abstract theorizing. It really allowed us to also be practical as well as reflect. So I found the process really helpful and really interesting. Thanks very much.
Thank you very much, Crick. Has anybody else attempted to promote mutuality within collaborations and want to kind of share any similarities or differences in what was done in this project with yours, Ursula?
Hello, hi. Sorry, just put my video on. Hello, hi everyone. Hi. Yeah, it has been really interesting to be part of the process. I think, yeah, it shows what's possible and also what was really challenging. I mean, just on very sort of pragmatic, practical basis, was like internet connections just so difficult to create a space where it feels that everybody can participate equally, and things like, you know, who can have their camera off and on already kind of introduces some kinds of inequalities in those spaces. But I think Hannah's just arrived at my door. Sorry. She lives next door to me, so I'll come back to you on that. Hold on a moment. Carry on, and I'll.
Anyone else want to jump in to the discussion?
Hi, Tessa.
Hi.
I did actually just want to talk, just share some of my own experiences. I think, you know, we talk a lot about how we need to talk more within groups and how it's always been a challenge. I personally learned a lot from other people's experiences and insights. I was part of the scaling pod, but most of all, I think what I learned is to reaffirm that while, you know, perhaps there does need to be a central coordinating groups, which you guys from KCL did really well. It is possible to create mutuality and share narratives, and despite all the time zone challenges. So I think that's an important takeaway for me, because oftentimes, you know, I read a lot of research that still says, oh, this is a challenge. But I was like, well, yes, but it is possible. So yeah, that's it from my end.
Thank you for being the voice of optimism, Anisa. That's really that's really good to hear. Sophie Walker, do you want to come in?
Hello, can you hear me? Hi, my name's Sophie. Thanks for a great session. I've learned a lot, and yeah, it's been really great. I'm based in Tanzania, and I'm doing some work here with older adults, adapting and piloting a program that was developed by Sangath, which is basically problem-solving therapy. And I have two points. One is about the kind of structural issues that I've really noticed about trying to kind of allow mutuality to flourish in my work, my experience. And the structural issues that I'm talking about really relate to the institutions and also the professional status of the individuals that you're working with. And I wondered if this has come up for anyone, but for example, in my work, I as PI was a local psychiatrist, and then kind of co-I and supervisor for all the lay counsellors was the clinical psychologist, the only clinical psychologist for pretty much the whole of northern Tanzania, based in Moshi. But clinical psychology is not a registered profession here. And so as a result of that, the amazing woman that I'm working with is not actually, she's only academically employed by the college. She's not employed full-time by the clinical institution in a sort of in a capacity that we would recognise as a kind of shared role. And that really impacted on her ability to I guess, leverage her position to, I guess, take ownership over the mutuality that we both, and I think the whole team, wanted to enable, but she simply couldn't, because both her clinical role wasn't recognised and her academic work is also not fully supported, although that's somewhat recognised. So that was one thing, kind of the professional status or the clinical status of the individuals that you're working with. Even if you create a kind of framework that is truly mutual, whatever that is, there's only so far that can go. And I guess that's about advocating and about activism, about kind of policy change. But any recommendations on that? And then the final point, sorry for a long question, was actually about just the kind of pragmatics of I think stuff that's come up to do with communication, but to do with internet access and Zoom, etc. But two solutions that we found that were useful was to buy like not a bundle, what's it called, like a freestanding internet connection device. Forgive me, the names just slipped out of my head.
Is it a dongle?
A dongle, thank you, not a bundle, a dongle. So I bought a load of dongles, which really helped, and a speaker, a Jabra speaker, which is like, I'm sure you all know them, but it's like, so you can do like conference calls quite easily, so a group could kind of gather around it, but that was really, they're not that expensive, it's really transformative. Also WhatsApp, I basically don't use email at all, and all communication, which I feel has really engendered really kind of mutual communication between both senior figures who you'd think in a maybe a more UK context would be really inappropriate to WhatsApp somebody, and then also WhatsApp groups as well has been really helpful. So yeah.
There's some great points and some really helpful practical tips that definitely, yeah, resonates. Dörte, did you want to jump in on that?
Yeah, I had a few thoughts around the idea of what Onaiza was saying earlier around the leaderless structure, because we've reflected on that a lot. We had this idea of being able to actually sort of like gently merge into the background and actually don't take much of a role and let the pods really self-organize. But we realized that exactly that was one of the biggest lessons, that the kind of power sharing process needs to be scaffolded very heavily and very heavily supported in order to actually allow people to come together and have a creative process. So at the end, and I think that was a surprise for us, it was the most helpful for us to always be there as one co-facilitator from the organizing team. And like I said in the chat already, that Milena's note-taking is probably what has saved the entire process, and always connected the dots between meetings, between different attendance, like different compositions of the group. It was not always the same group that met in a way, because people didn't always attend. So I think there are huge learnings here around facilitating a space, or like actually taking on a lot of the administrative labor in order for others to have the space to just participate, and not having to put in a lot of the planning labor, the administrative burden of taking notes. At the same time, we also always struggled with how is it that we don't want to make decisions of how things move forward, to always bring it back to the group. But it was a much more active role than we had envisioned originally. So this is maybe one of the learnings from our side, that we would perhaps like just implement differently from the start, rather than thinking one can actually just step out and say, you go ahead, especially when we're working with such unequal access and existing barriers to participation. And we didn't actually have a time to really speak about the structural fundamental constraints and barriers here. And we felt like, and we're writing an article about that as well at the moment, that in order to create more and truer mutuality, one would have to break quite a bit of the institutional constraints that we're operating within, including where the funding comes from, the digital infrastructures that we have access to. One participant mentioned that it's not just the access to data and phones, it's also she had to travel sometimes 60 kilometers to where she could actually participate in one of the online meetings. So there's all these inequalities that need to be considered in this process. So I think our biggest learning had a lot to do with like how to facilitate the sharing by actually taking on more of a role. And I think, yeah, that was a bit of a surprise for us in a way. And I'm glad, Onaiza, that you say it worked well. But I would be curious to hear how other people deal with that. And yes, Sophie, the issues you're mentioning, it's interesting to hear that you use WhatsApp, but I can actually imagine that working really well. And the problem of status and recognition, I mean, by putting people from very different backgrounds into the same space, people who often don't talk to each other, don't work with each other, there is sort of, our intention at least was that there is a way in which we can share each other's epistemic power, to say, if we as a collective write a commentary with all these different forms of knowledge represented, that will lend some of this kind of, or like create kind of a collective voice where people who may not be able to advocate for themselves individually in their setting can then say, oh, here we work with King's College and so on, that we actually lend each other the status that from where we sit, and make that available to as much as we can. That is kind of also part of the idea of mutuality. But I don't want to hog the microphone. I just wanted to share a few of these thoughts from our sides and our learnings as we were trying to facilitate this process. But Ursula, I see you're back and Hannah is hopefully by your side. Do you want to pick up your thought from earlier?
Hello, hi. Sorry about that. Yes. I was really enjoying listening to you actually, Dörte, just then, because I think the points you made were really helpful. I wanted to say something about, that sort of finding what you were just talking about, the language, finding a kind of shared language and terminology, I think is a big issue. I think it's very easy to fall into our accepted terms and not realize that that they're sort of quite specialist. They may not have the same meanings. So I think that's one important thing, is that finding that kind of language, and taking that care to make sure that everybody's understood and on the same side, and that we're all speaking the same language. I agree, WhatsApp sometimes, in most of the collaborations I do, I find that WhatsApp is the most useful tool. People that don't respond to emails find WhatsApp, it's a more informal, it doesn't need much bandwidth, it's a more direct and personal level of communication. So I find that really valuable. And that thing about you were mentioning about the distance, I think just from working with colleagues in Ghana, also Nigeria, you realize that just the sheer day-to-day effort of doing things, to getting electricity, getting water, even for middle-class academics, is time-consuming, stressful, and I think we very seldom take that into account, that kind of unseen coping with day-to-day that is needed to be available for things, to get to things on time, it's incredibly stressful. And I just want to urge everybody to just give that a thought, that when you turn the lights on, when you wake up in the morning, that is not always, and it's not necessarily about money, it's about infrastructures within the countries where you live, and systems to get access to funds can be incredibly complex for people. So yeah, thank you. That was what I wanted to say.
Yeah, no, that's a great point, very well made there. I think I'm guilty of myself sometimes, based in London, that it's easy to overlook some of these kind of basic challenges. I can see that we've got various people on the call who were involved in this Together to Transform project, but we've also got quite a few people who weren't, and I would really love to hear from some of those people as to how some of what has been discussed today as an exercise in trialing mutuality might be relevant or not to your work. If anybody is bold enough to share some reflections on mutuality in their own work. Does anyone want to comment? Ashraf?
Yeah, I just had a thought based on what was just said and what was said earlier, which is the role of language, and language as a container of concepts. And sometimes the English language is certainly the language that we use, but when we discuss things in a scientific forum, but there are also limitations in terms of the concepts that are contained in English. And so, you know, the idea of I was just in the Middle East, and the idea of sumud, countering a sense of despair and hopelessness, and gaining self-competency and agency, and mastering life choices with dignity and steadfastness. you know, in the Palestinian context, being steadfast and being rooted to the land involves activism and going. It's kind of going beyond the individual-centered term such as resilience, which is what English has. So thinking more broadly linguistically about ways in which we can apprehend these concepts that can potentially be elusive in the English language. That's all I got.
No, thank you, Ashraf. That's a really valid point. Anybody else want to jump into the discussion? Charlotte, did you have any thoughts or reflections thinking about, I know there's been a lot of discussions lately about the direction for the Centre for Global Mental Health and how we can better promote mutuality in our partnerships. We'd love to hear
everybody
on the topic.
Hi, I was hiding. Yeah, thanks so much. It was such a rich and interesting discussion and so very relevant. Yeah, I was very struck actually what you were saying, Dörte, about the scaffolding, the sort of the transitional, the process that's needed. And a few people spoke of kind of the work and the length of time that is required for that and the flexibility around that. So in terms of the centre, I think this is very much what we want to think about. What is a way of expanding who has a stake in the Centre for Global Mental Health and how they can be involved, but without burdening them or imposing. And I think, so we're starting sort of some discussions with the idea that it's always good to ask people some thoughts about what they would like. But of course, those questions occur in existing power relationship. And so we have to think a little bit creatively about who we ask, not just the usual suspects who've been happy to work with us and have kind of, I see with my colleagues here, you know, they sometimes sort of accept the rough with the smooth, you know, oh, well, on balance, you know, perhaps overall it's beneficial for us, but, you know, that's not really allowing people to flourish. So I think it would be, I think the way that you do things, the way that you set up the processes are so critical and really frame what is possible. So I'm really interested to hear about sort of the way you're trying to create the spaces, because I think we need to think about that particularly. But I'd just like to really congratulate all of you and really enjoyed hearing. Thank you so much.
Anyone else want to chime in before we get to the end of our allotted time with any thoughts about this project or about mutual relationships, mutual learning more generally? Thinking about the relationships between people working from the global north and the global south, or between academia and its interface with people doing the real work on the ground. Any final reflections from anyone who is involved in Together to Transform, thinking about lessons to be shared?
How about yourself, Tessa? Would you want to share what the experience was for you? I'm also thinking about interdisciplinarity. So we try to square a lot of different circles here. So I don't know, do you want to share with maybe from your perspective a little bit, how did you find working in the platform, but also even us as like an organizer team, as a social scientist and someone who, I mean, without wanting to pigeonhole you as a numbers person, but I thought it was very interesting for us also working together and bridging interdisciplinarity.
Yeah, you're overestimating my numerical skills. No, I mean, I was very conscious of the constraints that, you know, there are lots of, anything that is convened by academics in the global north is inevitably, you know, set up from that perspective and framed from that perspective. And so there are lots of ways in which, you know, we didn't achieve ideal mutuality, and that that we didn't overcome all of the challenges, such as time zones. Today, for example, there's colleagues from New Zealand who, you know, are not able to join because it's the middle of the night. So, but I guess, you know, what we're trying to sort of make the case for is for that continuous process of reflection, and that it's worth thinking about these things and pushing for greater mutuality, even knowing that we're going to fall short. Which I guess, yes, is the take-home message on this topic, I think, from us. Onaiza and Milena have both got their hands up, so let's hear from Onaiza first.
Thanks, Tessa. I just, you know, I hear you guys about the administrative burden that's associated bringing lots of people together and facilitating conversation. And I'm just wondering, after all this reflection, and this is an open question to everyone who coordinated and participated in the pods, if you had the chance to go back and do it again, what would you do differently?
I think one thing would be to have more time. I think we underestimated how much longer things take if you try to make decisions by consensus rather than having some leadership, some clear leadership where some people say this is what we're aiming for and this is how we're going to get there. It inevitably takes a lot longer. So I think it would have been better to have had, you know, a year or more rather than sort of racing to try and get some outputs by the end of 8 months. Yeah. What about you, Milena? Any thoughts on what we should have done differently?
Yeah. I don't know. I was going to end on kind of an optimistic, or just from my perspective, seeing the whole process is very formative. I think because I'm a very, very junior researcher, it was very important for me to consider how mutuality kind of should be at the core of any research idea or any research process. And I think this was a good example to me of kind of the messiness of doing that kind of research that feels like you have gotten somewhere from a process of consensus and mutuality. And I've really appreciated it. I don't think I would have had the chance otherwise to have mentorship from people outside of my academic sphere and to learn from people all over the world, senior academics or experienced community organizers. And it's definitely shaped how I see academia and kind of what the future could bring for people who now have the chance to start their careers considering these things from the very beginning. Yeah, so I'll definitely take that forward.
That's great, thank you. I guess one of the things I should really highlight is that you really need a Milena or somebody with Milena's organizational skills in order to make something like this work. This definitely would have fallen apart without Milena coordinating us all and holding everything together. Ursula, who is actually Hannah.
Thank you. Bit confusing. Yeah, thank you so much. It was amazing to listen to the pods, the conversation, and about the question, what one could have done differently. I think sort of what I have certainly taken away from this is to look very carefully where to apply for funding so that shared ownership of and shared leadership is possible. That something like a mutual learning platform is not led solely by sort of King's researchers or Global North researchers, but that the applicants themselves are reflective of, let's say in our case, the pods. And I think if we go forward with this I would strongly urge us to have a joint leadership from the get-go. And then I think the division around sort of organizing, managing, etc., will also be naturally shared in a different way, but also to make sure that when we apply for funds, that we are really mindful of the strings that are attached to the money, so that the money itself is not just managed by an institution like King's, but can be directly transferred in bulk to different institutions who then can sort of manage their own funds, just like we manage the funds here. Because again, I think money is just so powerful in terms of what ideas can be generated, whether one has to ask for approval on how to spend money, etc., rather than just do it. So I think these are things that for me are really important going forward, sort of really joined up leadership from the get-go, from the idea development, making sure that funds are not just sort of located in one institution, but also spread across several institutions, so that a different form of sort of leading, managing, and then working together is possible. Thank you.
Yeah, no, that's really helpful. Really helpful. Great. Well, thank you so much to everybody who has joined us today, who's presented, who's participated, who's shared their thoughts. It's really great to have a bit of a space to share and reflect on what we've learned about mutuality through this process and how we might learn from it in other projects going forward. Do you want to wrap us up with any final thoughts from your end, Dörte?
I have not prepared any final words other than to thank really everyone who participated in this process, and that I'm hoping that sort of the conversations and relations we have created over these 8 months do continue forward, that we do find different pockets and momentum and energy to keep that going and to create something more sustainable, but also to think about, this is what we're doing from our side, to really think about mutuality as a method and to think about key ingredients that we can distill from this process that can help us sort of systematically break the structures that need to be broken down. It was Hannah was just saying about how funding needs to be organized in order for the entire process to look differently, to kind of really work out and articulate the change we need to see in order for this to become more normal, but also more feasible and kind of a routine conversation. And interestingly, as we were having discussions with our participants about how do we measure mutuality, or how do we account for whether or not a process has been informed by mutual principles, again we ran into the question or like the difference between qualitative and quantitative researchers thinking, are there sort of markers of mutuality that we could come up with that could be applied in a kind of quality assurance framework to partnerships and collaborations, and others felt like you cannot measure it, it is really up to and defined by everyone who participates in it. So articulating principles of mutuality rather than just sort of lofty values and goals, I think, and putting the rubber on the road, maybe like Craig was saying, being practical about it without foreclosing the larger discussion, what it means and why we're doing it, to sort of work on both ends, I think is something we're hoping to have started with this process, and to articulate a few ideas from our side, but to also really see all these pods and groups go off and on and do other wonderful things with the connections and collaborations that have been created in this space. So it's been a hugely, like Milena was saying, formative and enriching experience, at least on my side, on our side, from organizing this and being actually privileged to learn and be in the presence of all of these amazing minds and thinkers coming from very, very different backgrounds, places and positionalities. So I can't thank everyone enough to show up for it over and over and over again, even though it was sometimes a bit frustrating, but also hugely rewarding. And I do hope that it will continue to generate these multiple ideas and outputs and energies where people find each other in their shared experience and shared priority and continue to make it count. And yeah, thank you all for coming today, for listening to us, for listening to all our presenters, and hopefully taking some of these nuggets forward in your own work.
Thanks very much, everyone. Enjoy the rest of your day.
Thanks.